Hello, Kevin. After looking at your chart and your past medical history and everything that we've tested, what I think that we're having a big issue with is chronic pain. And so where I would like to start is educating you on what pain is, what specifically chronic pain is, because studies have shown that when patients know more about their pain, when they understand what pain is and how it works, it tends to produce better outcomes and help resolve their pain a little bit better.
Okay.
Does that sound good?
Yeah.
Okay, so there's two forms of pain. There's acute pain and then there's chronic pain. So acute pain is like, say if you like hit your hip on a counter or you stubbed your toe on a bedpost or something like that. It hurts right away, hurts really bad. And then your body, it's like adaptive transient and puts your body into a protective role. So like say you might like take a weight off of that foot because you want to give it time to recover and there's like an injury right at that spot. And it's just an overall unpleasant experience.
Okay.
And chronic pain, on the other hand, is like a life-changing experience, and that's where I think you are. This has it impacted?
That's what I have?
Yeah. Like, do you feel as though your pain has impacted like your day-to-day life? Can't do as much.
Yeah, I can't. I don't do anything. I go home and sit at night. I work and sit all day, and I just every time I feel like moving to get up, like it hurts all the time.
Okay, yeah. So that is more of this chronic pain, and that's maladaptive. It's persistent, and then it's causes neuroplasticity. And so what that is, it's just changing in your brain, and that's really important because pain comes from how your brain perceives it. So your brain can choose to perceive or not perceive a painful stimulus, or it can choose how severe like the pain you're feeling is.
Okay.
It's all real, it's all pain, but it's all just controlled by your brain, and so that's where it really comes into play with the chronic pain.
Okay.
So more about the pain science. One thing I noticed in your chart is that you were taking a muscle relaxant and some strong opioids, and so I wanted to ask you how that medication has been working for you.
Well, when I first started it, it was just, I felt like a new man. I took it and it felt better, but the more I took it, I felt like I needed more, and it just wasn't helping. Like, no matter how much I took or whatever, the pain was still there.
Okay, and so what research has found with opioids and especially chronic pain and using it all the time is that we acquire this thing called opioid-induced hyperalgesia, and that's just some big fancy word. Yeah, I was like, just some big fancy words that says that your pain receptors become more sensitive because of the opioid medication. And so that just means that a smaller stimulus of something like maybe before you had to run a mile to feel pain, this might mean like you walked for 5 minutes and now you feel pain because those receptors are a lot more sensitive to the pain.
Okay.
And so that's why us as physical therapists, we want to focus more on education and movement and sort of maybe tailor you off that medication, because I saw that on your goals you wrote that you would like to sort of scale back on your medication as well.
Yeah, I just want to get off of it, and I really don't want surgery, so I just any other option.
That's what we're here for. We really want you to reach those goals as well. And then the other thing I wanted to address to you, because patients interpret it different, is that you did have an MRI done and they found that you had a bulging disc at L5-S1. And so I wanted to know how you felt about that.
Well, that must be where I have my back pain. I mean, if I have that bulging disc, like, and my back hurts all the time, I just assume that's why.
Mm-hmm. So that's actually a fair assumption. A lot of people do think that, like, okay, they found something wrong, so there must be something wrong, that's why it hurts, that's what needs to be fixed. But interestingly enough, in research has shown that in 40% of non-symptomatic patients, they have bulging discs as well. So that means they don't have pain, but they have bulging discs. And so that brings us to the idea that injury doesn't always mean pain, and pain doesn't always mean you'll have an injury. Like, sometimes it does work that way. A lot of time within that acute category, that's how it works. But more in the chronic category, those two things might not always equate to each other.
Okay.
The next thing I want to bring into, so there's a physical therapist and pain researcher named Adrian Lau. And so he did a lot of research into how pain works works, and how it affects us as human beings, and he works in physical therapy, and that's what I really want to bring into you and educate you about. So like I said, the more you know about your pain, the better you'll be able to deal with it, the better your body will react to it. And so you have nerves throughout your body, right?
Yeah.
So they're all connected, and they're a security measure for your body. And so I'm going to bring up this chart. So your nerves are always active at a certain level, but that level is below this line. This line is our pain threshold.
Okay.
So they're active until you come in contact with a pain threshold. So that's like if you stubbed your toe on the bedpost, and then all of a sudden you come up above the threshold, you feel pain, and that's your body's security measure alarm system to tell you that you need to take protective measures. You either need to take weight off your foot, maybe if you're a little more pain, like say you broke your toe or something, you might need to go in and get help.
Okay.
But if you didn't break your toe or anything, you just take your pain off your foot, and pain doesn't go away right away, but how long would you say the pain from that is going to persist?
Maybe an hour or two, and it'll decrease, maybe.
Yeah, but not like a few months, a year, or anything like that.
Mm-hmm.
So that's what happens is the nerves usually, they come up, they spike, and then after a little bit, they calm back down to this base level. Okay. What happens in chronic pain patients is that they don't come back down all the way to this level. So they come down to about here, and so that's what we call sensitization, extra sensitive. So now instead of needing this large area of a stimulus to bring you up to feeling pain, you only need to do a little bit of movement to feel pain.
So that's why when I get out of my chair, it just hurts.
Yeah, it's because you're extra sensitive.
Okay.
Your nerves and everything are extra sensitive to that pain stimulus.
Okay.
And so that's why before you're I felt like I could do more before I got pain, and now it only feels like you can do a little bit until you get pain.
Okay.
And then another thing with that sensitization is, so you have your medication that was prescribed to help you deal with the pain, but your brain actually produces chemicals that make you feel better. They make you feel better chemicals, happy chemicals, calm you down. And that's considered a wet brain, is that term. And so normally they release that chemical to help you deal with the issue, so you can think about what to do.
Okay.
What happens in chronic pain is the longer it takes, your brain starts to take some of those chemicals away, and so you get what's called a dry brain. And so that dry brain, because your brain's not producing as many chemicals because it's been happening for so long, happens, and then you're also more sensitive to that pain.
Yeah.
And so what I would assume you're maybe thinking right now is well, I want the wet brain one, right?
Sign me up for that.
Yeah. How do we get to there? So the first thing which we're doing right now, and which we'll continue to do throughout our session, is this pain education. That helps because the more you're aware of it, the more your brain knows what's going on, you're conscious, you're working on it. Another thing is aerobic exercise. And I understand from someone to when you're maybe not that active and everything hurts when you move, it sounds scary, oh, am I going to have to go run 10 miles? Yeah. That's not the type of aerobic exercise we're looking at. So more about your level right now, even going on a few 20-minute walks a week, just a brisk walk. And that's not saying that you won't feel pain, because you're always in pain, because that's essentially how chronic pain works. You will feel some pain, but remember how I said earlier, injury and pain don't always go together.
Yeah.
So you'll probably feel some pain, but you're not going to injure yourself. You're not going to make your back worse. And the more you do that, your brain learns to not equate moving with pain. And so over time, your body's oh, I can do this. I'm not going to hurt myself. So it's not as sensitized, telling that alarm to go off in your head that you're going to be injured.
So I can
Does that make sense?
garden without hurting my back more?
So, more so, which we'll get into a little bit earlier, our progression plan. But we're going to start small, and what we're going to focus on is more functionality movements. Okay. So we want to build off function, because right now, would you say you are pretty functional in your life?
No, I sit just all day.
And that's no fun if you want to, like, say maybe you want to go, like, to your grandchild's, like, game or something. You can't walk there, walk around and stand. So we want to work on functionality. And so I'll talk a little bit about that in a minute, but I want to go back to some other things that we can work on.
Okay.
So also eating certain foods can help you. Sleep hygiene, because I also noticed that you said you've been having trouble sleeping. So sleep hygiene is just quality of sleep, time you're sleeping, that helps. Relaxation, and then manual techniques that we can do for you, and physical therapy can also help. And so with the exercise strategies, like I told you, research has shown that with chronic pain patients, basing your sessions around function improvements rather than pain improvements, because we know you have pain, and we know that you want pain to get better, but we don't want to focus on that pain all the time. So what we're going to do is we're going to focus on the function, and we're going to incorporate this education, and I'm going to continue to educate you while we work on the function at the same time.
Okay.
And all of these, I think, will really help you achieve all the goals that you want.
Yeah.
Do you have any questions on anything I've said?
Just like maybe if you have like a pamphlet or something.
Yeah, I can
take this.
You can take the chart, and I can print you out some more information on chronic pain and how to manage it.
Yeah, that's perfect.
Okay, it was nice talking to you.
Yeah, you too.